The importance of early diagnosis in oral cancer is to try and achieve the best prognosis for patients. If a patient is diagnosed with the disease in the early stages, survival can be as good as 80 to 90% at 5 years. If a patient is diagnosed with late stage disease, survival falls off dramatically and is only at about 25 to 30% at 5 years. So there is a big difference in the survival. This series of videos, and indeed the work of our charity and our campaign, is trying to raise awareness about this disease. As such, raising awareness will hopefully improve the number of patients that are diagnosed with disease early and so improve survival.
When examining your patient, it's important that they are sitting in an upright position. You should start off with an extraoral examination and start by feeling the lymph nodes in the neck. Starting off in the submental area, moving back into the submandibular area and up towards the mastoid. And then moving down along the neck, feeling the cervical nodes and down to the supraclavicular area. When carrying out an intraoral examination, it's important to start by looking at the lips. So invert the lips and have a good feel and a look around for any abnormalities, both the lower lip and also the upper lip. Using a pair of mirrors, then, you need to get your patient to open their mouths and have a look at the buccal aspect of all 4 quadrants, starting on the upper left, down to the lower left area, moving along to the lower right, and up to the upper right area. Opening the patient's mouth wide, then you need to have a good look at the buccal mucosae on both sides to make sure that there are no abnormalities. It's then important to look at the palate using your mirror and then we need to have a look at the floor of the mouth. So if you ask your patient to lift their tongue up to the back of their mouth, you can have a look at the anterior floor of the mouth and then also work your way posteriorly to make sure there are no hidden lesions on the lingual aspect on both sides of the tongue. Finally, you need to have a good look at the tongue. To do this, it's quite useful to use a piece of gauze. So if you ask your patient, first of all, to just stick their tongue right out, and you can have a good look at the dorsum of their tongue. And then using the gauze, the gauze can help you to look at the lateral borders of the tongue if you stretch the tongue to one side and then to the other, so that you can have a good look at the lateral borders. Finally, it is also useful to ask the patient to stick their tongue out and say "ah," so that you can have a good look at the posterior soft palate.